Hello and welcome everybody. We're going to get the webinar started just in a few moments, and just wanted to start off by saying thank you to everybody for joining us here today. We know everybody's got a lot of things going on, and so we're going to try to make sure that this webinar here, we're going to get started on time, but we're also going to make sure that we really focus on what we think is the really important information for all of you who are joining us today, who are newer families and patients to the SMA community. So we'll get started, and we'll try and keep this on time, and we may even do this in a half-hour time slot. As again, we'll try and kind of focus down on the really key issues. What I think we wanted to do today, and why we thought this should be a helpful webinar to put on for all of you, is we hope that you've been getting a lot of the information that we've already been putting out, that we have information and resources on our website. We've also been putting information out through eBlast. We've done some other webinars for the whole community as well. And definitely, we would say all of that information is relevant to all of you as new families and patients also. And that information is relevant, important, and it's something to pay attention to. But there are also a few areas, a few topics that we think should be a little bit more of a higher priority and top of mind for all of you as new families and patients to pay attention to. There are also things that are going to be newer for all of you to get used to and understand why we do certain things in a certain way in the SMA community. And we wanted to make sure that you've got this information and these few topics were really top of mind for you all as well. So I think that's what we wanted to try and focus on in the webinar here today. I think also what we wanted to do just to start off, and we hope a lot of you have experienced this already, which is making sure that you know that there is a community here, and we as an organization, Cure SMA, we're here to support everybody in the community. And I think all of us, families, us here at Cure SMA, we all want to do what we can for new families that are coming in and support you in any way we can as well. And I think it's a very strong community. Hopefully you've experienced that as well. And that's going to be something that is actually going to be very important as we deal with this new issue that's come up, to have this very strong, supportive, cohesive community out there. What's also interesting is that SMA is this rare disease, and we're often separated by kind of the physical locations where we all are. But right now, everybody's in the same boat, and we've all had to kind of switch to looking at doing things online, virtually. And that's where we as an SMA community in particular are very strong. And so now that we are all working online, there's so many opportunities to connect, get support, learn from others in the SMA community. That's going to see us in a really good way going forward as well. So one of the key things that we did want to highlight here is, while we're dealing with this new disease, and the whole world is, the actual approaches to cope with this disease are not new to the SMA community. There's things that the SMA community has learned to do over the years in terms of isolation and quarantine that the SMA community normally does with the flu season and cold season, that are now relevant for everybody. But this is what the SMA community knows how to do, why to do it, and how to work through being isolated, staying at home. So there's a lot of things that are already in place in the community, knowing how to respond to a situation like this. And again, here with you as newer families coming in, we want to make sure that you get up to speed on the reasons why and how to isolate, how to stay safe and quarantined as quickly as possible, so that you're really prepared for this current situation. So I think at a very high level, there are two very key issues that we wanted to again say should be top of mind for all of you. One is the aspect of how important it is in terms of getting onto treatment, the time to starting treatment, and that's particularly important here. We'll certainly talk about maintaining as well. But there is a critical aspect of getting onto some form of treatment as soon as possible is one of the most critical factors in SMA. And that is relevant still now as well, even though we're dealing with this situation. And so there's a few kind of general approaches that we put out there, things to bear in mind. One aspect for this is, don't wait for something that may be out there in the future. And so this is the aspect of, if you have access to getting onto a treatment right now, you should take that treatment. It doesn't actually matter what it is, whether it is Spinraza or Zolgensma. If that's what you have available right now, it's more important to get onto a treatment than waiting for something that you think may be better coming in the future. And I think there as well, it would apply when we're looking at the next treatment that we hope is going to get approved, risdiplam. That's out in the future. And if you have access and you can get started with a treatment now, that's what you should be doing rather than waiting for something, a possible something in a few months' time. And I think the aspect here is that definitely maintaining those treatments is going to be something important long-term, but just starting up, getting the first dose of Spinraza going, getting, obviously it's a one-time, but the Zolgensma treatment going, that starting point is probably the most critical thing. You'll hear this, I think, in some of the other slides. There is a little bit of flexibility when you start talking with Spinraza about the maintenance doses that happen over months in the future. But it's that starting point that really is critical that we need to kind of look at as urgent, essential right now, even with the current situation going on with isolation and quarantine. The other aspect, so that's one, this timing to treatment and how important that is. The other aspect that we're talking about is the isolation protocols, procedures that the SMA community is used to doing, again, in the normal flu and cold season. Those are things that we need to have in place now. A lot of families and patients have been in that anyway from the winter months, but now we need to continue those on. And so that is something which is going to be really important. We know how to do it. We now need to maintain those right now. And I think we'll get to this as well a little bit longer into the future as well. And we need to be kind of prepared for that. So if we go to the next slide. What we're putting out to generally everybody in the community is to have an expectation as well of how we're currently approaching the situation is going to carry on for quite a long time. And for people to get, prepared for that and know that this is going to be kind of a long haul for us as a community. We're used to doing this isolation. We're used to the hygiene approaches that you normally kind of need to follow in SMA, the isolation protocols in flu season. We're going to have to be doing those right now, the same as most of the general population, but we're also going to have to go longer as well. And I think this is something really good to bear in mind now, that it is going to be tough for people to keep this going. It's very important, and hopefully everybody understands why, but this is going to keep going for quite a few months. We're going to have to go longer with these isolation protocols than the general population is. We have to be more careful in the SMA community generally, so we're going to have to extend these out beyond weeks, potentially months, than what you might see for the general guidelines for the general population. I think, again, though, this is something that we're going to be well set up to deal with, that, again, we have this strong community that's available to all of us, again, here at Cure SMA, but also all the families that are out there in the SMA community online. And I think over time, what we'll see is, there's the aspects of learning from the SMA community, these approaches, but there's also, I think, over time going to be much more a reliance on getting support, getting assistance, especially dealing with this long-term isolation as it happens, keeping connected with people, keeping networked. We're actually going to be in a really good position in the SMA community because, again, we know how to do that. But over time, as this kind of keeps going and we've got to stick with it, that's going to be important too. Two other little things, and again, I think hopefully a lot of you have got this now, that we do need to be more careful in the SMA community, primarily because of this high pulmonary risk that's there in SMA anyway. That's why we have to be careful with colds and flu, and with COVID-19. That's very important now as well. That's obviously something that's very much affected if you get infected with COVID-19. That's going to be a risk, and we are generally vulnerable to that in the SMA community. So that's why we have to be very careful, extra careful than the general population. We also wanted to pass on that as far as we know right now, and this would be our assumption and what we would follow on, is that the SMA community is actually doing pretty well right now in staying protected from getting infected. We don't think that's because there is any special immunity from SMA or in any aspect there from the disease itself. And so we can't let our guard down. We think that the low impact is coming more from people in the community already knowing and following these isolation protocols. So the next slide. To go over some of the treatment aspects again, and again, this is something that we put out for many years. We put it out to the general community as well, that, in SMA, it's that time to getting on a treatment and staying on treatment, which is critically important. That's what stops damage to the motor neurons, getting onto a treatment, and the sooner that you can do it, the better. It's something that we put out that this is not something which now becomes low priority or what's called elective because of the COVID-19 issues going on. This is still essential. It's still life-saving. And again, the aspect of actually starting up is even more important than in some ways kind of the maintenance, where there's a little more flexibility. And I think that's something that we put out, that these are essential. There is a little bit of flexibility that's built in, especially when you're talking about the maintenance dosing. And you can be flexible when you're looking at potentially, moving things around by a few weeks. But that's kind of what we put out as the recommendation, that flexibility should be in weeks and not months. Things shouldn't be getting delayed for months at a time when you're looking at getting onto the treatments. And especially there in terms of starting the treatments, that is something which we would say, yes, you do have that flexibility again of a few weeks. You need to look at your own personal situation, where you're located, if there's a lot of cases that are happening, what's happening in your local hospital systems where you might need to be a little bit flexible. And you have weeks, but even there, again, the starting is kind of the critical thing that we really need to make sure that people do get onto one of these treatments. And again, any one treatment is the important part. It's not picking one better than the other. It's the time to getting access to what's out there right now. One item that we put out as well is quite a few new families and patients get into some of the clinical trial opportunities, not just the approved therapies. Those are important as well to keep going. And there should be some added flexibility that's built into those clinical trials right now, where rather than sometimes always having to go into a hospital setting, not just for a treatment, but for a follow-up scheduled visit to monitor what's happening, those can sometimes be done more flexibly now, and sometimes even done at home and telemedicine and things like that too. So if we want to go to the next slide, and I think this is where I'll actually hand over to Mary. Mary, if you want to take over from here.
Yes, thank you, Kenneth. And I want to emphasize and support everything that Kenneth has said, and I'll go a little bit deeper in some of those areas. Next slide. So let me just take a moment if people are not familiar with me. I'm Mary Schroth. I'm the Chief Medical Officer at Cure SMA. My background is that I'm a pediatric pulmonologist. I feel very honored to be able to speak with you as part of this webinar, and thank you for joining. Everyone is inundated every day with information about coronavirus and COVID-19, which is the infection component. And as everyone knows, the US now leads the world in the number of cases. We think that the US may be peaking in the number of new cases identified per day. The greatest challenge in managing COVID-19 and why it is different than any other virus that we've dealt with to date is how easily it's transmitted to other people. Plus, there are people without symptoms who can also spread COVID-19. So that's why it's just so important to talk about the isolation protocols. And as Kenneth mentioned, the SMA community as a whole is very experienced in maintaining isolation, especially during this time of year. Next slide. I want to emphasize that our priorities at Cure SMA are the health, safety, and well-being of the entire community. It's just so important that we give you accurate and timely information, and that everyone's health is really at the top of our mind. Just know that we are here for you, and we're in this together. COVID-19 impacts everyone, but we're here to support you. If there's things that we can help you with, please let us know. Next slide. On our homepage, you will see that at the very top, we direct people to the COVID-19 resources that we have. And it will take you to the second page there, which is our Coronavirus COVID-19 Information Center. On that web page, you'll see an opportunity to sign up for the support package that we have available. And also there are a number of templated letters. We have frequently asked questions document to try to answer everyone's questions. Please let us know if there's additional information that we can add to this web page to help support you. Next slide. So I just want to review, because these are so important, the general recommendations to stay healthy and safe during COVID-19, especially for those with SMA. The general recommendations are staying at home, social distancing has made the biggest impact in decreasing infection rates. Avoid large gatherings. And I know that's really hard during this time, especially if you have a young child and everybody wants to see the child and be with them, but use social media, use video conferencing to share. It's just so important to limit close contact, avoid others who are sick, wash hands often. If you need to travel, travel by car. And the other thing is to use this time to review or develop your illness plan. Do your routine. If you routinely use cough assist machine, continue to do that routine. Don't change things as long as you are healthy, but be prepared for potential illness. Next slide. We also recommend that you stock up on supplies, all the things that you need to stay safe, the antibacterial wipes, medications. If you typically have 2 to 4 weeks on hand, we recommend having an additional 1 to 2 months of supplies and equipment on hand as you're able to obtain them. If you have state Medicaid insurance, some of the guidelines have been relaxed and you may be able to obtain additional supplies. It's important to, if you have concerns about health, to contact your healthcare provider or primary care provider. Completing immunizations is very important. And as Kenneth said, it's important not to delay treatment for SMA. If you have access to treatment, can get treatment, schedule it for as quickly as possible. If things have been delayed, it's okay to delay for 1 to 2 weeks potentially, but as you said, the sooner things get started, we know that the outcomes are better. So in order to, there will be a lot of concerns about going into the healthcare system. I encourage you to talk with your healthcare provider in advance, your primary care provider in advance. Ask about registering in advance. And also ask whether you can be placed into an exam room as soon as you arrive, and in order to avoid the waiting room, which is the problematic area. Many clinicians have days where they only see well individuals in their practice. And those are the days to be scheduled. But check with your healthcare provider what their practices are. I encourage you to also check the CDC website for complete guidelines, latest information. Check local or state public health department websites to be up to date in information related to your area of the country. One thing I didn't mention in the last slide, and that is social distancing is really important, but if you are in a situation where social distancing may be challenging, please use a mask. If you have a small infant, it's important that everyone around you or around your child uses a mask. In the public sector, a cloth mask is very good. Healthcare providers are using the medical equipment, and so it's so important to preserve the surgical mask and the N95 mask for those that are in the healthcare system, as we know that those supplies continue to be limited. Next slide. So I wanted to briefly go over typical symptoms, and they may appear anywhere from 2 to 14 days after exposure. The usual symptoms are high fever, coughing, and being short of breath. Additional symptoms that have been reported are GI symptoms such as diarrhea and upset stomach. And there have also been other symptoms that have been associated with mild COVID-19 infection, such as sudden loss of smell and taste. And the scariest part is that most people don't have symptoms, but they can readily transmit infection, which again is why social distancing is so important, and wearing a mask. If you want to be tested, if you think you have symptoms and want to be tested, check with your healthcare team. Testing requires a physician order. Please don't order at-home kits, as these are scams. Next slide. So again, I encourage you to monitor the COVID-19 Information Center for new content. And if you have additional questions, please send them to info@yoursma.org. Next slide. I just want to briefly mention that we also need your help. We have several surveys available to complete, including newborn screening registry survey. If your child was diagnosed through newborn screening, there's a newly diagnosed survey that's available, and also for everyone, a community update survey, which is available through the middle of May. Next slide. Thank you, and I will turn this over back to Kenneth.
Thank you. And I think if we go on to the next slide as well, do we want to have Jess, Colleen take us into more of the support area?
Great. Thank you. If we could just go to the next slide. So my name is Colleen McCarthy O'Toole, and I'm the Vice President of Events and Family Support. And I just wanted to briefly touch on some of the new support packages that we're offering. Mary did mention these, but we had just launched the week before last, we had just launched a new support package for SMA families, which is a small box that we'll ship out to families that includes essential things right now that really help with COVID-19, like antibacterial wipes, hand sanitizers, tissues, lotions, those kind of things. There's even activities to keep children busy while they're at home. In order to receive one of these, you just need to fill out the application on the website. There is a link right here, but you can also just go ahead and email Cure SMA at info@curesma.org or at familysupport@curesma.org, and we'll go ahead and send you that link to fill out the form. Next slide, please. We're also just offering, which we've just announced this week as well, is a new assistance program that offers SMA families a $50 gift card in order to help them buy essential items like meals or groceries. You can use it to have on like Uber Eats or Grubhub as well to get meals delivered to your home. So again, you'll just need to fill out the application for this, and the link is on the page, and feel free again just to go ahead and email us at familysupport@curesma.org. And next slide. Now I'm going to go ahead and turn this over to Jessica.
Thank you so much, Colleen. So we wanted to just briefly touch on one of our largest family support programs, and that is our annual SMA Conference. Many of you may have already seen this announcement, but unfortunately, due to the current global health pandemic, Cure SMA announced our decision last week to actually cancel the 2020 annual SMA Conference, and that was to be held in Orlando, Florida this coming June. Any families who are eligible to receive the scholarship for this year, you'll still be able to use that scholarship for the 2021 annual SMA Conference. And we'll be sending out an email with information and details on how to get you registered through that scholarship, and we'll send that out prior to the launch of our 2021 conference registration. So since we're all unable to be together for conference this year, our hope is to bring some part of the conference into your own home. And we plan to launch a 2020 annual SMA Conference webinar series, as well as some virtual networking opportunities. So stay tuned for more information on that to come. Next slide, please. We want you to know that Cure SMA is here for you. We're here for you and your family in any way we can be, and whether that's through offering resources, support, connecting you with your local chapter, or connecting you with other families, or just answering questions in general, please feel free to give us a call or email us anytime. Some of our other support programs that we provide are our informational packets, care packages, and our organizational binders, and those include some local resources as well. We have a wagon program where we send out wagons for families, and they use these around the house, outside, and sometimes they'll take them to appointments as well. We also have an equipment pool of items that we loan out to families, and we can send those out. And then we have our Summit of Strength programs, which are one-day mini conferences, and we hold these in different cities across the U.S. We also offer teen and adult care packages, and these are available to any SMA affected teen or adult who is ages 13 years and above. And then we offer primary care provider packets, and these are specifically designed for medical professionals, and we can get those sent out directly to your medical professional, or we can send them to you for you to pass along to your medical providers. And then again, if you ever have any questions, you can reach out to us directly at familysupport@curesma.org. Next slide. I'm going to turn it over to Dr. Al Friedman, who is a psychologist and SMA father.
Good afternoon or morning, wherever you may be. My name is Al Friedman. I'm a practicing child and family psychologist, and I'm also the father of a young man affected by SMA. I'm located just outside of Philadelphia, and I'm very honored to participate today. Years ago, my own child was diagnosed with SMA, and others through this same community supported me. So I'm here today to offer my support to all of you, both as a professional and as a parent. I'm going to share a few thoughts on how to manage the stressors associated with not one, but two major challenges in your lives. Because an SMA diagnosis is a huge challenge for any family, and this pandemic is a second huge challenge for all of us. So why is all of this so stressful? These huge changes in our lives can feel very uncomfortable for all of us. It's normal for our sense of safety to feel threatened. It's common to have a wide range of very strong feelings in reaction to these two very unusual disruptions in your lives. Many of my current clients and many parents of newly diagnosed SMA kids over the years have experienced a wide range of feelings, including feelings of disbelief and denial. This isn't real, Dr. Al, this can't really be happening. Feelings of anxiety. I'm really scared, Dr. Al. When people start taking charge of the situation they're in and getting things done, then we tend to feel more in control. And then finally, we were able to look past the immediate crisis to the future. The pandemic won't last forever. And with treatment, your child's situation will very likely change for the better. So these different feelings from disbelief, denial, anxiety, feeling control, looking to the future, I'd like you to think of these emotions not as steps we go through in a specific order, but as we adjust to these abrupt changes, these feeling states are more like rooms in our house. We move between these feelings in no particular order. So an important point I'd like to make today is that we do have the power to influence how much time we spend with these feeling states, just as we have the power to move in and out of rooms in our house. Next slide, please. On one hand, our community of SMA feels understandably physically vulnerable, but as Kenneth and Mary said, on the other hand, our community is in a very strong position to understand and manage the feelings that come from this pandemic, because we have a lot of practice with unexpected change and surprise. We have practice with living with uncertainty. We have practice at facing adversity. And what I'm hearing from everybody who preceded me, I'm going to amplify. Our SMA community is here to help and support you. That's what our community does best. We know how to face complicated challenges. Next slide, please. Because you've experienced an SMA diagnosis relatively recently, having some practice at handling the unexpected does help. But the anxiety related, both to SMA and to this pandemic, the anxiety you feel is real and it's understandable. The situation we're all facing together is scary. So these feelings of vulnerability do need to be acknowledged and respected. There are things about the pandemic that don't feel within our control. And there are things about an SMA diagnosis that don't feel within our control. So what I'd like to do is encourage all of us to focus on what is in our control. Next slide, please. Now, here are four basic things we have in our control that I'd like to encourage us to focus on. First, taking care of ourselves is in our control. It often comes down to the basics in my work as a psychologist in my practice. It's important that we all get the basics. Enough sleep, enough food, healthy exercise, balanced nutrition as much as possible. It's helpful in this situation when we need to be isolated to take care of ourselves by allowing sunlight and fresh air into our living spaces, to spend time outside if you can safely. It'll make a big difference if you get outdoors. It has for me. And exercise as much as you can, however you can, whatever that means for you, indoors or out. Taking care of ourselves means relaxing our mind and our bodies as much as we can with meditation, with relaxation exercises, and thinking exercises. Do the best you can to think positive thoughts. This is based on a method of treatment called cognitive behavioral therapy. It's important that, bottom line, we allow ourselves to rest and relax as much as we can. Second, we do have the ability to make choices about how to use our time. That's in our control. It'll help to create and maintain a familiar routine. Keeping familiar routines will help you feel more comfortable, help you feel more in control. Right now, our routines might need to be different than the ones we followed before the pandemic, but as Kenneth and Mary said, we've got practice at needing to stay to ourselves when illnesses are around. So we probably already have a good sense of a routine. It's important to stay with it. We're often creatures of habit, our families affected by SMA. It's important that we make choices about the use of our time during this pandemic by using what I'd like to call fear distancing strategies. This virus is contagious and so is fear. So we need to distance ourselves from the fear. And I think it's important that we all limit exposure to the news and get enough news to know how to keep ourselves safe. But more than that may trigger more anxiety, which isn't helpful. So I'd recommend keeping our news intake to a minimum and avoiding news before bedtime. It'll also help to focus on things other than this virus and other than SMA. So you can take breaks from thinking about these challenges. Enjoy movies, TV shows, read good books, do anything that's relaxing and fun. Making a choice to use our time in these balanced ways is in our control. Third, preparation and planning. As Mary said, having a plan with your healthcare provider and following all the protocols, as Kenneth mentioned, getting the treatments for your children, doing whatever you usually do, given your child's medical situation is important. Planning ahead is important. Having whatever lists of medications or supplies, whatever you know you need, you'll feel more confident, you'll feel more in control if you've prepared and you've planned ahead of time. It'll help you feel safer about what you're doing for your child. That's how it feels to me still all these years later. Planning helps, preparation makes me feel less anxious and more confident about my ability to care for my son too. That's in our control. And finally, how we stay connected with others is in our control. I'm really not fond of the phrase social distancing. I think that to be safe and healthy, we need to combine physical distancing with lots of social connectedness. It's important, especially after a child's diagnosed with SMA. I know this personally and professionally, to stay in contact with close friends and family. And through this pandemic, it's a good time to reconnect with old friends too. Using technology to stay connected to others as we are using today, video chatting helps us all feel more socially connected. You might discover, as I have, how easy it is to connect using video technology that you may not have used before. My entire counseling practice has gone online and it's working much better than I would have expected. And my social contacts with friends and family have gone to video and it's really helped me personally too. Being the parent of a child newly diagnosed with SMA or being an adult recently diagnosed with SMA is very different than it used to be because there are treatments now available. But having a child diagnosed with SMA remains very challenging in many ways. And just as it helped me to connect with other families, it'll help you to connect with others in our community as well. I encourage you to stay connected any way you can, especially through these very unusual times. We are all here to support you. I know from, next slide, please. I'm not sure if it's mine or if that's my last slide. Nope. I'll finish by saying, I know from my many years being part of our Cure SMA community and supporting many other families through my work that our community is well prepared to help you face both of these very unusual challenges in your lives and to keep doing what Cure SMA has always done so well for me personally and what we've all done for each other, which is to take good care of one another. I thank you for the opportunity to be of support to you. Be safe, be good to yourselves, and we're here to help you. Thank you.
Thank you so much. That was great to hear, and thank you to all the speakers. We would like to now start on the Q&A session, where we are going to answer some of the questions that were submitted in advance. So I'm going to ask the first question of Dr. Schroth. Does getting treatment make my child more susceptible to coronavirus?
Thank you, Leslie, and shout out to Al. Thank you so much for reframing how we think about the current times. And I think bringing Al's voice to this webinar also demonstrates how important it is to have a multidisciplinary team involved in your care and in your world. So to answer the question, receiving treatment for SMA does not make the person with SMA more susceptible to coronavirus, and it is important to receive treatments for SMA in a timely way. Thank you.
Great, thank you. And Jessica, you were talking a bit about conference, and so there was a logistical question. My child was just diagnosed with SMA. Will I be receiving a scholarship for conference?
Thanks, Leslie. So yes, you are eligible to receive a newly diagnosed scholarship. However, with the cancellation of the 2020 annual SMA conference, your scholarship will now be available for you to use for next year's 2021 annual SMA conference. And again, we'll be sending out an email prior to the launch of the 2021 registration, so you'll have all those details. But if you do have questions just regarding what a scholarship covers, or maybe you're looking for more information on the overall feel of the conference, you can always reach out to us directly, and we'd be happy to answer those questions for you. Thank you.
Great. We have another treatment question. What if treatment is being postponed or delayed? Dr. Schroth, what should folks do in this situation?
Thank you. As Kenneth and I said earlier, receiving Spinraza, receiving treatment, Spinraza, Zolgensma, on time is a very high priority, but there may be other complicating priorities that result in delays. We recommend that getting doses as close to schedule be a high priority. A few weeks delay should not have a huge impact, as there may be specific personal health status issues or local COVID-19 issues that could influence your timing options. If your scheduled treatment dose has been delayed, please work closely with your healthcare provider team to reschedule the Spinraza dose for as soon as reasonably possible. We do not recommend viewing these doses as elective or non-urgent, and dosing should not be delayed for a significant time. Again, work closely with your healthcare provider team to be safe, talking about pre-registration and also being placed in a room as soon as you arrive so that you can avoid the waiting room. Thank you.
Great. The next question is about quarantine. In fact, the next two questions are about that. How long should families who have maybe a new baby with SMA, how long should they stay quarantined?
So my recommendation is that you should anticipate being quarantined longer than the general population. The risk for complicated COVID infection seems higher, number one, in infants, and also is higher in individuals with underlying health conditions. So it'll be, it'll be important to stay up to date with what the recommendations are. Just know that if your community is relaxing the isolation protocols, to be very cautious about that. We anticipate that the SMA community will be relaxing the isolation protocols at a much slower rate, a much more cautious rate. If you need support to be able to continue to work from home because your employer is wanting you to work in the office, and it works better for you to be remote because of your situation, please again go to our COVID information website. We have letters and supporting documents to help make your case to continue to stay at home for a longer period of time. Thank you.
Great. And our last question is sort of a, I would say, tack onto that. And is there anything extra that people should be doing during quarantine if they have a baby with SMA?
Having a baby during COVID-19 is complicated all by itself, and it necessitates isolation. I really like Al's words of physical distancing and social connecting. It's important to not let other people hold and be with you if you're not sure of their exposure to COVID-19, and yet having virtual contact in the variety of platforms that are currently available. In addition, it's important to work with your healthcare provider to obtain immunizations and complete well checks. Kenneth had mentioned earlier about the risk of viral infections in individuals with SMA. And the risk is that when you have a viral respiratory infection, everybody is weaker during that time. The respiratory muscles are weaker. If you have SMA, it's exaggerated. So it's just so important to have a pulmonary care plan if it applies to the individual with SMA, and to work closely with your healthcare team in case of illness. Number one is to avoid getting sick, but we also recognize that things happen. So then being prepared is your next best plan of attack. Thank you.
Wonderful.
Great, I think that's, go ahead, Colin.
Yeah, no, I just wanted to say thank you all so much for joining us today. It was great to have you, and definitely stay tuned and watch our news posts and social media as we announce more webinars going forward. And please, again, do not hesitate to let us know if there's anything that we can do for you and your family. Just go ahead and email us at familysupport@curesma.org or give us a call, and we're here for you anytime. Thanks so much.